Hello everyone, welcome back to my channel. Today's topic is otitis media from ENT, Medical Surgical Nursing. Let's get started with the video. Otitis media is a disease in which there is infection and inflammation of the middle ear. It is basically caused by bacteria or virus. Otitis media can be acute or chronic. That means that can stay for less than 6 months or longer than 6 months. This is a diagram where there is comparison between normal middle ear and then middle ear containing otitis media. As we can see, the middle ear, tympanic membrane present in the middle ear is fully inflamed, and the yellowish discoloration seen in the other side is the discharge. The discharge is filled in the inner ear. It is also present in the middle ear as well as it comes towards the outer ear. Its cause or etiology can be, first of all, bacteria. Streptococcus pneumoniae can be the main bacteria. Virus can also be a cause, Haemophilus influenza. Else than that, there is upper respiratory tract infection like rhinitis, pharyngitis, edema and exudates in the middle ear, rupture of tympanic membrane. Pathophysiology can be, first of all, there is a risk factor like upper respiratory tract infection or acute otitis media. Because of that infection, there is collection of fluid in the middle ear and which causes obstruction of tympanic membrane. There is pus discharge from the middle ear towards the outer ear. That same pus which we saw in the diagram, because of which there is a necrosis over time. After necrosis, there is tympanic membrane perforation which will need a surgical management. This tympanic membrane perforation will come along with symptoms like fever, symptoms like rhinitis, other symptoms like dizziness, headache. We divide otitis media into acute and chronic. In acute otitis media, there is infection of middle ear that lasts for less than 6 months and subsides within time. Features of acute otitis media can be otorrhea, that is discharge from the ear, otalgia, pain in the ear, fever, rhinitis, tympanic membrane erythema, redness, abnormal redness, erythema, irritability, and hearing loss. This hearing loss is not sudden, it is gradual. As the pus, discharge, or fluid gets deposited in the middle ear, there is gradual hearing loss. We can diagnose acute otitis media, first of all, by obtaining history. We should take a history of any previous infection, any previous middle ear infection or upper airway infection, because they both are connected through eustachian tube anatomically. Also, physical examination or ear examination can be done through otoscope. Culture test of ear discharge should be done so that we can find out the nature of pathogen. Audiometry and tympanometry can be done to localize the site from where infection or inflammation has begun. Medically managing acute otitis media, antibiotics can be given. Amoxicillin is the main choice mainly, 250 mg per 12 hours. Also antihistamine, because there are some allergic signs and symptoms, antihistamine 5 to 10 mg once a day can be given. Also analgesics, ibuprofen can be given. If we want to manage this surgically, myringotomy and tympanotomy can be the options for surgery. According to disease condition, according to state of the disease, choice of surgical method is done. Let's come to chronic suppurative otitis media. Chronic suppurative because there is discharge deposited in the middle ear and which has remained in the ear for a long period of time. Infection and inflammation of middle ear that lasts longer than 6 months is chronic suppurative otitis media. It has a separate feature, that is otorrhea, which is due to permanent perforation. Chronic suppurative otitis media is common at the age of 3 to 6 years. Risk factors for chronic suppurative otitis media can be, first of all, inappropriate treatment of acute phase. If there is inappropriate treatment or incomplete antibiotic therapy during acute otitis media, it can relapse. Also, there is upper airway infection, which can be a risk factor. Allergic rhinitis, eustachian tube deformity. If anatomically eustachian tube has an abnormal shape or size, that can be a risk factor for chronic suppurative otitis media. Nasal septum deviation, cleft palate, when there is division between the palate in a newborn, that newborn can be at risk for chronic suppurative otitis media. Also sinusitis, as sinuses are closely related with the airway and airway is related to the middle ear. The infection which is in sinuses can be transmitted, the pathogen can be transmitted to the corresponding organ. There are types of chronic otitis media, types with features. First is Atico antral, and then next is tubotympanic. Atico antral involves inflammation of bones like mastoid and ear ossicles, whereas tubotympanic otitis media is characterized by discharge and perforation. There are also other symptoms in tubotympanic like loss of appetite, fever, etc. In serous otitis media, which is the next type, there is tympanic membrane perforation, necrosis, and mastoiditis. Here we come to the diagnosis. Diagnosis of chronic suppurative otitis media. While diagnosing about chronic phase, we need a complete history along with previous infections and allergy. Also, we need duration and intensity of the problem so that we can find out from which phase can we start the treatment. Also, we should ask about regular medication that the patient is having, diet of the patient, and lifestyle. While assessing the patient physically, we should check whether there is presence of erythema, edema, otorrhea, lesions, or other characteristics such as odor and color of discharge. Medically, if we want to manage chronic suppurative otitis media, first of all, there should be a careful assessment of air. Then we have many kind of medicine. We have drops, we have IV medicine, we have tablets. Drops can be Ciprodex, antibiotic drops that destroys the pathogen topically. If the patient is admitted, IV amoxicillin, ofloxacin, and ceftriaxone, also known as triple therapy, that should be given. Doses should be as per the weight of the patient. Because there is fluid loss from the body during this infection, patient's weight should be measured, age should be considered, state of the disease should be considered, and then antibiotic therapy should be decided. For otalgia, we have analgesics, which can be provided 250 to 500 mg per day, as our patient can be of any age. So, analgesics dose should be discussed with the doctor and then given. Surgically, if you want to manage chronic suppurative otitis media, there is ossiculoplasty, removing the part of bones which are infected. Also, tympanoplasty, removing the part of middle ear tympanic membrane which are infected. Nursing management for otitis media. First of all, you should provide general assistance to the patient because the patient have diminished hearing. Also, the patient should be instructed to lie on the affected side so that drainage can pass easily. Antibiotics dose should be completed to prevent a relapse of infection. The cotton placed in the ear, if the patient uses cotton because there is continuous discharge, the cotton should be changed according to need. Okay, if there is too much of discharge, cotton should be changed within hours. If there is mild discharge, it should be changed within few hours. But if the cotton sustains for longer than 24 hours, infection might get aggravated. So, that cotton which is placed in the ear should be taken under consideration. Complications of otitis media can be hearing loss, which is a gradual process. Hearing worsens to hearing loss. Tinnitus, which is ringing sensation in the ear. Also, there can be recurrent infection of middle ear. If there is recurrent infection of middle ear, it can get transmitted to upper airway, causing infection like pharyngitis, rhinitis. Such infections can also occur. Thank you so much.